During this American Heart Month, we are taking some time to highlight the symptoms of heart attack to be on the lookout for, especially if you're a woman. Heart disease is the leading killer of women, responsible for around 32,000 female deaths every year. While the most common symptom of heart attack is chest pain, that's not always the case for women. There are more subtle symptoms like pain in your jaw, back, or arm, dizziness, or even flu-like symptoms.
This morning, we are taking a closer look at the symptoms women specifically need to be aware of.
We're joined now by Dr. Mandira Mehra of SSM Health. So good to see you.
Great to be here.
This is concerning because the symptoms for men and women can be so different.
Totally different. And, you know, we looked at the studies and it shows that women can take up to 30% longer to even go into the hospital when having some of these symptoms that may be traditional or some of the non-traditional symptoms. We all know that television, that movie scene where someone clutches their heart and falls to the ground. So I think that's something we all have in our mind, that that's a heart attack, and it could be, but it doesn't have to be, and especially in women. It may just be a slight chest discomfort, like you said, a jaw pain, maybe pain to the arm, shortness of breath, fatigue, dizziness, just not feeling well, general malaise. Now, I get a lot of questions. Dr. Mehra, what if I just don't feel well and I'm tired today? Does that mean I'm having a heart attack? Now, the really important thing here is to look for red flag symptoms or something that feels out of the ordinary. So you know what, if you're kind of run down and tired every day, you may not be having a cardiovascular event, a heart attack, but if something's different, suddenly you're sweating, you're diaphoretic, you're short of breath, definitely rule out heart disease first. Don't wait and say, let me see if I calm down. Am I anxious? Am I nervous? Am I having, acid reflux? A lot of people will say, oh, I'm just having acid reflux, or I'm anxious today. Definitely rule out the heart first. That is essential. We need to make sure that that structural damage doesn't occur and we still have blood flowing through the heart. Now, we talk about this being the leading killer for men and women on Earth. This is the leading killer of men and women on Earth. Every 8 seconds, we think that a woman in the U.S. is diagnosed of a heart attack. But how many of those are preventable? Here's the statistic here, is we can't change our age, we can't change our family history or our risk factors, but 80% of heart attacks are potentially preventable. That is a shocking number. That means our lifestyle modification. That means working out, smoking less, not drinking as much alcohol, looking at those other risk factors like high cholesterol, what we're eating. These are modifiable risk factors that we really can modify and prevent 80% of heart attacks. So when you look at that statistic, that means we need to raise awareness. We need to tell women that these are risk factors in your control on a daily basis that we can modify. So when your favorite doctor tells you to sleep more, eat better, work out, don't sit as much, cut back on the smoking and drinking, it's really because we want you to have the happiest, healthiest life possible.
All right, good advice as always. And Dr. Mehra, this is a bittersweet morning for us.
It is, I know, matters of the heart. So this is with a heavy heart. I guess I'm signing off officially after 5 years. I have to thank my Channel 3000 family and definitely the viewers for the inspiration, the opportunity, and I wish everybody happiness and health moving forward. Thank you so much for this incredible opportunity.
You've been just a shining beacon of information on this show, and we will certainly miss you, but we're excited for your next step in your career.
Absolutely.
And for your family.
And we will keep in touch, for sure.
All right. Well, good luck with everything.
Thank you
so much.
Thank you so much.